Well, I want to talk about peripheral neuropathies as a category because they occur from stem to stern, brain to toe, and they all really have the same basic underlying cause. Peripheral neuropathies are caused by squeezing of peripheral nerves. Let's take the 12 pairs of cranial nerves. There's 12 nerves that are formed in the brain on the right side and 12 nerves that are formed in the brain on the left side. They all pass through the skull and do things primarily outside the brain. For instance, everybody knows about Bell's palsy. One side of your face sags, looks like you had a stroke, but really, you haven't had a stroke. What's happening is the roots of the 7th cranial nerve, also known as the facial nerve, get squeezed. The motor toning effect of that nerve is lost, and everything in your face sags. Okay, same thing if you have terrible pain in your face. It's caused by squeezing the roots of the trigeminal nerve. The trigeminal nerve is the 5th cranial nerve. Causes tremendous pain. Of course, dentists love it because they'll do root canals on it. It'll kill the pain because they're getting rid of the nerve out of the roots of your teeth. But really, the pain continues to exist. And there's 12 pairs of cranial nerves. And, of course, there's a pair of spinal nerves that come out from between every pair of vertebrae, starting at your cervical vertebrae in your neck, your thoracic vertebrae in your upper back, your lower vertebrae called the lumbar vertebrae, and so on. Okay? Let's start out with additional ones up in the head. Of course, we already talked about Bell's palsy, trigeminal neuralgia. People lose their voice because of the squeezing of number 9, this cranial nerve number 9. I believe it's the glossopharyngeal nerve, and so on. Then you get into the chest, and you get the nerves coming out from between, the spinal nerves coming out from between T1, 2, 3, and 4, thoracic vertebrae, thoracic vertebrae 1, 2, 3, and 4. And this happens because of a shrinking of the disc in between the vertebrae. The vertebrae get closer to the other, smash the roots, and this can cause atrial fibrillation. There's nothing wrong with your heart, but the nerves that control the rate and rhythm of your heart emanate from your spinal cord from between T1, 2, 3, and 4. Okay, so we have to deal with that. And then, of course, in addition to that, you have typical sciatica. People know about sciatica, where you get pain and numbness and tingling from the sciatic nerves, which are the longest nerves of your body, go from your lower back all the way down into your toes. And these are the sensory nerves. So you get pain, tingling, numbness when the roots of those nerves get squeezed. But there's also an internal branches of the sciatic nerves which control your bladder. And so people who they come to me and they say, oh, yeah, I've had UTIs, urinary tract infections for 20 years, been on antibiotics for 20 years. The antibiotics don't seem to help, but the doctors don't know what else to do. Well, that's because when you have a bladder infection for 25 years, it's not a bladder infection for 25 years or 10 years or 5 years or 1 year or 3 months. It's a back problem where the motor roots of the sciatic nerves are being squeezed that are the internal branches that go to your bladder. You don't empty properly. You can have incontinence. You're urinating on yourself without even warning. And then you get burning on urination. This can be caused by a squeezing of the roots of those nerves from the lumbar area that control your bladder. And then, of course, this is an endless parade of things. Well, in the book, God Bless America, there's charts. God Bless America, there's charts of all of the peripheral neuropathies from the internal branches and the external branches. In other words, let's look at sciatica. Everybody knows about sciatica, but when you lay down and you get creepy crawlies in your legs jerk around spontaneously without you able to control them, that's called restless leg syndrome, and that's a squeezing of the motor roots of the sciatic nerves, okay? So there's motor roots, there's sensory roots, there's inner branches or outer branches, and they all cause different things when they get squeezed. So the charts tell you about that in the book God Bless America, and then the trilogy books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy tell you how to deal with it. But the easy way is to deal with the Healthy Bone and Joint Pack, because our goal here is to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, very important with peripheral neuropathies, support maintenance repair of the disc between the vertebrae, bone makes bone itself. And then you want system support. For instance, if you have restless leg syndrome, in addition to the Healthy Bone and Joint Pack, I would also throw in things for the muscle, things for the nerves, like de-stress capsules. I would also throw in selenium, stuff for your eyes. I would throw in Vision FX, more selenium. Also, don't forget immortalium to help regrow everything, right? Remember, the immortalium extends the life and health of telomeres, which extend the life of your chromosomes and your cells' ability to duplicate and repair themselves. So peripheral neuropathies really don't require surgery. They don't require surgery. They require nutrition to support and promote maintenance repair of the disc, to support and promote maintenance repair of the systems that are involved being squeezed here when you have a deficiency of various minerals. It's kind of interesting how that works. Okay, so that's kind of where I would go, and you'll be amazed at what you can do for your own peripheral neuropathies. Of course, chiropractors can give you relief. Naturopathic physicians can give you relief. We actually have, for instance, our CM cream and CM Plus capsules. You can take the CM Plus capsules orally, get some relief for the internal branches of these peripheral nerves. The CM cream you can apply. Let's say you have burning in your feet because you have sciatica. You put the CM cream on your feet, nothing's going to happen. They'll still be burning. You got to put them up in your lumbar area. Take away that inflammation around the roots of those sciatic nerves. That's now once you understand the physiology and what's going on there, you'll be amazed at what you can do. Stick with us. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
I thought we'd talk a bit about good bacteria, as I have a story here where the headline reads, Research Study Takes Deeper Look at the Role of Gut Microbes in the Immune System. They say new research suggests that gut microorganisms do not merely influence immune cell infection, or function, that is, but also support the production of immune cells. Investigators from the Regenerative Medicine Institute at Cedars-Sinai and Mount Sinai School of Medicine, in concert with the California Institute, say previous research studies have evaluated the influence of gut microbes and the function of immune cells, but little had been known about their influence on the production of immune cells, a process known as hematopoiesis, and they say this was all published in the journal Cell Host and Microbe. Investigators found that mice lacking gut microbes were defective in immune cell production. Consequently, those same mice lacking the gut microbes were more susceptible to bacterial infections. Helen Goodrich, PhD and collaborating author and assistant professor in the Department of Biomedical Sciences and a research scientist in the Regenerative Medicine Institute, says, we now have a clearer understanding of how gut microbes influence immune cell production. They say this also suggests that antibiotics may have unwanted effects on the immune system by depleting gut microbes, thereby compromising immune cells production, which could make a patient more susceptible to subsequent infections. What's the first thing they usually do to patients when they go to a hospital? Give them antibiotics.
Exactly.
Yeah, and according to another researcher on this study, Alberto Yanez, a PhD collaborating author, says we also believe that the depletion of gut microorganisms in humans could lead to a suppressed immune system and a higher risk of acquiring broad-range infections and diseases. So once again, the problem is the doctors that overprescribe these antibiotics all the time.
Well, we know they do that, and that's why we came out with the Triple Treat Chocolate, which has probiotics in it. We came out with FloraFX, a great capsule that has probiotics in it. And one of my favorites, Root Beer Belly, which has probiotics in it. It's a sprinkle. Tastes great. Tastes like a root beer float. I mean, kids love it. What a great way to get probiotics into kids. You know, I never let my kids get vaccinated. My grandkids, I don't let them get vaccinated. But guess what? I give them Root Beer Belly, and I give them Triple Treat Chocolate, build up their probiotics, build up their immune system. And, you know, I've got 4 kids, 8 grandkids, and 4 great-grandkids, and they just don't get sick. They get the 90 essential nutrients, but every day I take anywhere from 2 to 4 of those little packets of the Root Beer Belly. I just finished my 6-piece of Triple Treat Chocolate here during the break, and of course that gives me my probiotics there. And then twice a day I take some of the FloraFX. I mean, I just pump myself full of those probiotics because they fend off the bad guys. And so you have to be obsessive about this. People say, well, Wallach, you just spend your whole life taking capsules. You supplement with food and you live on capsules. Well, I do a lot of liquids. I do a lot of chocolate. I do a lot of capsules and pills and tablets. I travel with 5 suitcases. People say, why do you travel with so many suitcases? That's because I'm obsessive about my supplements. I've been taking the 90 essential nutrients, Doug, including all my probiotics, my digestive enzymes, and 90 essential nutrients twice a day for 67 years. I've been blessed with perfect health. You and I have been working together for what, 15, 17 years, something like that?
Yeah, it's about 15, 16 years. Yeah, I just recently started doing the Root Beer Belly myself. That's good stuff.
Yeah, and, I just don't have any health problems. I've never been on a prescription medication, never. The only piece of paper in my health file is my birth certificate. If everybody were like you and me, Doug, health-wise, the medical system would be real humble if everybody just went to them once every 75 years, wouldn't they?
Yeah, they would.
Well, thank you for bringing that one up. It's very basic stuff, but it's very, very important stuff. Hang on. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. And if you're one of these people that have what a doctor would call one of these autoimmune diseases, your body's attacking itself and all this stuff, that's absolute nonsense. As the British would say, poppycock. It's absolutely nonsense. These always occur when somebody has a gluten intolerance and you don't have the ability to absorb all the raw materials to rebuild things, okay, whether it's lupus or fibromyalgia, those kinds of things that are called autoimmune diseases. And then a lot of times they don't even know. They don't even have a diagnosis. People just feel bad. Medications don't work. And they just say, well, you have an autoimmune disease. We'll give you some cortisone, try to make you feel better, but there's nothing we can do about it. Well, here's what you want to get on: the 90 essential nutrients, get on the healthy bone and joint pack, get on the Immortalium, the new product that deals with telomere health and telomere length, and also get rid of gluten. Get on a gluten-free diet anytime you're diagnosed with an autoimmune disease, and guess what? Your body will be able to absorb the nutrients it requires to repair itself. The Immortalium will be kind of the switching director, right? The Immortalium is going to help you maintain and maximize the life of your telomeres, which is, of course, the most important thing when it comes to duplication of your cells in a normal way. Telomere health is all about it in the book Epigenetics. Ask your longevity associate for the new book, Epigenetics. Okay, Doug, let's go to callers.
Let's go to Colorado. And Heather, you're on with Dr. Wallach.
Oh, Heather, you're on the air.
Thank you. I'm calling because I was just misdiagnosed in 1999 and was given anti-anxiety medication. 9 years later, I had my gallbladder removed. And I have chronic diarrhea, and all the colonoscopy tests say that my colon is inflamed.
Well, guess what you got?
What?
You have a gluten intolerance, which could be called irritable bowel syndrome, inflammatory bowel disease, colitis, ulcerative colitis, Crohn's disease. It could be celiac disease. You've got, anytime you have this chronic diarrhea, you have pain in your belly, they take your gallbladder out, you have anxiety, all this kind of stuff. Do you have children?
Yes, I have one son, 45 years old.
Okay, now does he have any history of asthma or skin problems, any eczema, dermatitis, psoriasis, or belly problems?
No.
Okay, do you have any brothers and sisters?
Yes.
Do they have any of these problems?
No.
I don't believe you. You need to ask him. I'd also ask your son if he has any constipation or diarrhea, if he has any dry skin on the back of his arms, if he had any kind of dry cough when he wakes up in the morning, or maybe mucus when he wakes up in the morning, that kind of stuff. You know, something he really wouldn't complain to you about. Maybe not even go to a doctor about. Same way with your brothers and sisters, because you've got a gluten intolerance. Okay? What do you weigh, Heather?
I
Heather?
weigh 135.
Okay. Now, do you have any other issues I need to know about? Do you have any diabetes, high blood pressure, arthritis?
I have some arthritis, osteoarthritis in my wrist and first joint of my thumbs.
Okay. Anything else I need to know about?
I have a double scoliosis that was inherited. I've had breast cancer twice.
Well, that's serious. Okay, well, hang on. We'll be back, and we'll give you a program after these messages. Okay, Doug, let's go right back to Colorado and Heather. All right. Now, just before I go into what I suggest for you, in the beginning you said you were misdiagnosed, and what were you originally diagnosed with that they missed?
I was diagnosed with anxiety, and it was gallstones.
Okay, so they found the gallstones later.
9 years later.
Oh, my goodness. Okay. All right. Well, actually, I think the gallstone thing and the anxiety may have been related. Certainly, the colitis part, the diarrhea, it can be related to anxiety. Certainly, the scoliosis and the osteoarthritis are related. The breast cancer is sort of indirectly related because you cannot absorb the nutrients necessary to protect yourself from all kinds of diseases, including cancer, because your immune system requires all 90 essential nutrients. If you can't absorb them because you have negative changes in your bowels because you're gluten intolerant, and I believe you have a gluten intolerance. So the first thing I would do is get your whole household gluten-free. I want you to get a hold of our CD called Serial Killers. It goes into all the hidden places you're going to find gluten. And you need to be drop-dead gluten-free. No wheat, barley, rye, or oats. Absolutely no fried foods, no processed meats with nitrates or nitrites. It means no deli slices, sandwich meats, no sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, spam, canned beans, hot dogs, all that stuff's got to go. No oils. That means no olive oil, no coconut oil, no margarines, mayonnaise, salad dressings, or cooking oils. And then, certainly, I would, again, have you stay from wheat, barley, rye, and oats. Now, at 135 pounds and all this stuff going on here, I would take one healthy bone and joint pack, because you're only 135 pounds. I'd get an extra quart of the Osteo FX Plus, and I'd have you take 1 ounce of the Osteo FX Plus and breakfast and 1 ounce at dinner. There'll be 1 scoop of the Beyond Tangerine 2.0 NutriCrystals at breakfast and again at dinner. It'll be the 3 EFA Pluses a day, 1 at breakfast, 1 at lunch, 1 at dinner. You can take them all at once if you want. And then, because you've had your gallbladder out, I want you to take what we call ultimate enzymes. We call it the gallbladder in a bottle because it has ox bile in it. It helps you absorb fat-soluble vitamins, good fats, omega-3 essential fatty acids, and so on. And I want you to take 1 or 2 of those, say 2 minutes before each meal with a couple ounces of water. Then, because you have a history of scoliosis, what I want you to do is be sure that you get one of those incline boards and start out very minimally, sort of horizontal to the ground, just so you can learn how to mount and dismount the board properly. Do that twice a day for 10 minutes for a month. Then after a month, on this program, nutritionally restricting your diet properly, then lift your feet 5 inches above your head, so you're in a slight incline, twice a day for 10, 15 minutes for a month. Then after that, you increase the incline to 10 inches. Your feet are going to be above your head, 10, 15 minutes twice a day, and so on. And you only ratchet up once at that point. Every 2 weeks, you're going to incline your feet 5 inches more until eventually you're vertical. But I don't want you to do that quickly, because in the beginning, without doing it over a gradual time, because you'll tear something, you won't be happy with that result. Okay, call me every 2 weeks if you would here, please, Heather. Let me know how your intestinal tract is doing. Let me know how your pain is doing. Everything. Give me a report in 2 weeks. We'll be back after these messages.
Now let's head to Alabama. And Anthony, you're on with Dr. Wallach.
Well, Anthony, you're on the air.
Hey, Dr. Wallach, how you doing today, sir?
Okay, sir. How can I help you?
I've got a young lady, close friend of the family. She's 64, 125 pounds, 5'5.5", and has multiple sclerosis. And she told me that she fell off a horse quite a bit a long time ago.
Okay, now, I didn't get her weight there. Was it 165?
125.
Oh, I'm sorry. Okay, 125. Okay, do you have any idea how long she's had MS?
The singer?
85.
Okay, since 1985?
Yeah, that's when I was diagnosed.
Okay. And do you have a history, and I'm glad you're on there because I can ask you questions that only you might know the answer to. Do you have any history of skin problems, any eczema, dermatitis, psoriasis, or rosacea?
No, sir.
Okay. Do you have any history of chronic bronchitis or asthma as a kid?
No.
Okay. Do you have any children with any of those problems?
No.
Okay. Any brothers and sisters with those problems?
No, I'm an only child.
Okay. Now, again, do you let's see here. Do you have any history of any bowel problems? Your appendix taken out, irritable bowel syndrome, diverticulitis, bloating, digestive problems, gallbladder being taken out?
No.
Okay, so you've had a pretty unremarkable medical history until 1985, correct?
Correct.
Okay, very good. All right. Well, MS is actually damage to the white matter of the brain, the insulation material of the brain, okay? And this is called myelin. And this myelin insulates the nerve fibers of the brain and is random which symptoms appear first, which are typical of MS. And it could be blurry vision, it could be motor problems, it could be speech, it could be just something like stamina, all kinds of problems. And oftentimes your family practitioner might send you to an eye doctor if you get blurry vision before he even thinks about MS, or he might send you to his neurologist golf buddy if you have some peripheral neuropathies in your hands and face and so forth. Did you ever get things like Bell's palsy or trigeminal neuralgia or that sort of stuff?
No.
Okay, very good. Okay, well, here we go. The first thing you have to do is change everything you're doing, because it's what you're doing that gave you MS. Number one, I want to eliminate all the inflammatory stuff that are specifically doing damage to the myelin, the white matter of the brain. That means absolutely drop dead, no fried foods. Absolutely no fried foods. I don't care if it's an extra virgin olive oil or coconut oil, no fried foods. Okay, because they form trans fatty acids, heterocyclamines, and acrylamides, which actually cause many types of inflammatory diseases and lesions, including MS. Then, I also want you to give up processed meats with nitrates and nitrites. Absolutely no deli slices, no sandwich meats, no sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, etc., etc., etc. Absolutely no oils. It means no olive oil, no coconut oil, no margarine, mayonnaise, salad dressings, cooking oils. Then absolutely drop dead, no gluten. Anything to do with the brain, the heart, the liver, the kidneys, no gluten, no wheat, barley, rye, or oats. You have to live in a gluten-free household. Everybody in your house living in your house. A spouse, kids, dogs, cats, mother-in-law, cousin, auntie, anybody living in that household has got to be gluten-free because of cross-contamination in the laundry, the food preparation surfaces, the couch where everybody watches TV, the beds. It's that sensitive. Then at 125 pounds, I want you to eat 6 to 8 eggs a day. You could have 3 to 4 of them at breakfast and 3 to 4 with dinner. They can be soft-boiled with soft yolks, soft-poached with soft yolks, soft scrambled in butter, not margarine or oils. That's the raw materials to actually rebuild the myelin in the brain. And then I'd have you take one healthy heart and brain pack that's going to give you all the nutrients necessary to support and promote maintenance and repair of the brain. But in addition to that one healthy heart and brain pack, I also would like you to get an extra bottle of selenium. One bottle of selenium will come with that healthy heart and brain pack. And I want you to take 3 of those selenium capsules, Ultimate Selenium, 3 at breakfast, 3 at dinner. That's going to give you antioxidant power and actually support glutathione, which is the most potent antioxidant supported by your body to help your immune system get rid of the lesions from the MS in your brain. And I want you to take immortellin because I want the stem cells to work properly. I want the telomeres to work properly to help support rejuvenating of your brain, to support and promote maintenance repair of the brain lesions. So you have to stop the ongoing damage. That's the diet. You have to support maintenance repair. That's the eggs and the supplement program. Call us every couple of weeks, Anthony, because this can turn around very quickly. I've seen this happen, that there's recognizable benefit oftentimes in 4 to 6 weeks. Certainly in 4 to 6 months, you're going to see something. If everything is adhered to properly, you have every, what should I say, you have every reality that you're going to see some significant benefit here. Okay, Doug, we got time to start another one?
Yes, we do. Let's head to Jackson, Tennessee, and Nyan. You're on with Dr. Wallach.
Was that Diane or Nyan?
It's a pleasure to speak with you.
Okay, I'm sorry. I apologize. What's the name, please?
I'm sorry, Naeem.
Naeem.
Yes, sir.
Okay, Naeem, what can I do for you?
Okay, Dr. Wall, I'm 53, 5'8", 192 pounds. About 39 years ago, at the age of 14, I was diagnosed with juvenile arthritis. They always told me that I would grow out of it, but then I would probably get it later on in life. And, I've got gout in both of my big toes. I have showing signs of minor both hands and fingers. I also have a numbness, Dr. Wallach, in the right shoulder and the right hip. It just feels like it kind of tingles a little bit. It's not painful, but it just feels like the shoulder and hip is weak.
Okay, now stop there a minute. Have you shrunk any since you were 20 years old? Have you shrunk in height any?
No, sir, not that I'm aware of.
Okay. I'd measure yourself and check that out. It could be a peripheral neuropathy, or it could be just since you've had arthritis as a kid, This may be a feature of the arthritis. It could also be, I don't know, when was the last time you were at your general practitioner?
Probably been about 3 months ago.
Okay, and you told him you had this numbness in your shoulder and your hip, correct? You shared that with him, correct?
Yes, sir, I did.
Okay, and what did they have to say? What did he say? Did he give you any reason why that might be, or did he just sort of write it down?
He just sort of wrote it down, Dr. Wallach.
Okay, so he just took it as information, didn't reply to you to anything for that?
No.
Did he write you any prescriptions?
No, sir. No prescription.
Okay. Well, here we go. I'll ask you one or two more questions. Have you had any history of respiratory problems? Any asthma, bronchitis, that kind of stuff?
No, I have been diagnosed with sleep apnea with a CPAP machine.
Okay. Well, I'd put that on eBay. Get rid of that. Okay, and I'll tell you why when we come back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 90 for Life Crusade. And Doug, let's go right back to Tennessee and Naeem. Okay, basically, what I want you to do is 192 pounds is you got to get rid of all the bad stuff out of your diet. No gluten, no wheat, barley, rye, and oats, no processed meats with nitrates, nitrites, no oils, and no, again, fried foods, no gluten. So that's all 4 food categories you got to clean up. Then because of the gout stuff, I also want you to get rid of things like peanuts, beans, legumes of any kind. Got to get rid of them up because they set off gout attacks. Then I want you to get 2 of the healthy bone and joint packs per month. It'll be 1 ounce of the Osteo FX Plus breakfast and dinner, 2 scoops of the Beyond Tangerine Nutri-Crystals 2.0 at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner. All that will be accomplished by the 2 healthy bone and joint packs per month. Now, the gout, you're going to get these bottles of the CM cream, pain reliever. You can use the CM cream directly on the joints that are painful and so forth, whether it's your hip, your shoulder. But this is where we're going to start. And then I want you to call me every couple of weeks and let me know what's going on with the pain in the joints and the so forth. Okay, give me a call. And for the peripheral neuropathies, these things will all show improvement because this is supporting and promoting maintenance and repair. Okay, Doug, let's go to another caller.
All right, let's head to West Virginia. And Jim, you're on with Dr. Wallach.
Hello, Jim, you're on the air.
Hi, Dr. Wallach. How are you doing?
Okay, sir. How can I help you?
Yes, I wanted to update. I had 3 questions, but I wanted to update my mother-in-law. Called in a couple of weeks ago with Dr. Glidden on the show, and she had problems with energy, weakness. She had a blood transfusion, high blood pressure. She wasn't sleeping well, diabetes, and she had a fall with which she went to the hospital and had got morphine for pain. But Dr. Glidden said eliminate the 10 bad foods, get on the healthy blood sugar pack, and a bottle of selenium. But she will only take what she wants to take. And what I at least am doing is giving her the BTT 2.0, the Ultimate Daily. She was having issues with blood in her stool as well. The Ultimate Daily and Ultimate Selenium. So she's at least taking that, and her sons are making sure she does that.
Is she taking the sweet? I didn't get this. Is she taking the sweeties?
She's not taking the sweeties.
Okay.
I'm not sure if she will want to take it. That's one. But I know she should because of the diabetes.
Yeah, she's exactly right. Okay, so thanks for the update. Okay, now we only have a few moments, so let's get on with your
I'll try to get through it quickly. My wife is 5'7", 59 years old, and she weighs 209 pounds. She's diabetic. She's taking insulin, high blood pressure, thyroid, arthritis. And her knees are getting better because she's on the bone and joint pack and Ultimate Daily and Ultimate Selenium and enzymes.
Okay, and she's taking any sweeties? Okay.
And sweeties, yes,
good.
She's doing that.
And how long has she been on that program?
About no more than 2 months.
Okay.
And her knees are getting better.
Mm-hmm. Yeah, the knees will take a little bit longer than the blood sugar. The blood sugar, oftentimes, if they're very, very good about absorbing, and there's no gluten intolerance thing, and they're staying away from gluten and so forth, the blood sugar will be probably the first thing that shows dramatic improvement. Because let's say it's running 140, 160, in the morning before they medicate themselves. And one morning, within 2 weeks to 2 months, suddenly it'll be 110. And then it'll go down to 98. And it'll go down to 72 and so forth. And, of course, she knows how to keep reducing her medication. Diabetics are taught how to reduce their medication as their blood sugar drops. If their blood sugar goes up, they need to increase their medication, and so they know how to do that. And so the fact that she's seeing improvement tells me she's at least absorbing something. And what I want you to do is call me in 2 weeks and let me know what her blood sugar is, what it was when she started on the program. I want to know her weight. If you want to help her lose a little bit of weight, you can do that by getting her on the ASAP. Put her dropper full under her tongue 30 minutes before each meal. Let her absorb it through her oral tissues. Do not let her swallow it. 1 bottle a month will do that. She'll lose a half a pound to 2 pounds a day. Call me every 2 weeks, Jim. Give me an update on mom and wife, or maybe his mother-in-law. Okay. Well, thank you, everybody. Really great questions and testimonies today. Thank you so very much. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.